We did 2 scans in the office. One was of your nervous system for function and one was of your muscular system for structure. When you come in and look at these scans, you might see a lot of color. What that tells us is where are there subluxations in your spine. We ultimately want to see a nice, white, balanced scan with good symmetry. We rescan every 12 visits. Also, these subluxations probably did not happen overnight, so they really can't get corrected overnight. When you come into the office, we're going to give you a correctional care plan to get you to your goals and where you want to be and really help your health be at its optimal. So we'll see you soon. Being a mom is truly the most rewarding thing that I've ever done in my life. If your kids are anything like my kids, who are doing backflips off the couch and are going to school with all these germs, I don't even know where they came from, this is what causes subluxations and why they need to be adjusted. I just had this little boy come into my office just a couple weeks ago. He was on 4 rounds of antibiotics. He was on his way for tubes in his ears. We started adjusting him. The fluid came out and he didn't have to get surgery. I mean, how awesome is that? Kids don't just come into the office for ear infections, but they can come in for colic and digestive challenges and bedwetting and growing pains and increased immune response. It even helps with baby's latch to a mother's breast. The number one question that I get is this safe for my baby? And yes, absolutely this is safe. I actually went to school for 2 extra years so I could have a pediatric certification. And the adjustments are just so soft and gentle. I adjust my children regularly, and we really want you to know that we're gonna care for your children just like we care for ours. Hi, so if you're watching this next video, you are probably pregnant or want to become pregnant, and you're gonna see a lot of pregnant mommies in our office. We love having a bunch of pregnant bellies just all over the place. Just the other day, I had this mom come in and she was struggling with some constipation, acid reflux, and also her baby was not in the most optimal position. And we started adjusting her and she did not have to take Tums anymore, which was great, having really nice poopies. And then the baby actually turned into the right position and she ended up having this great birth. And honestly, nothing makes us happier than when a mommy comes back and tells us that she had the birth that she wanted. Other reasons why mommies come into our office could include headaches, hormonal imbalances, sleeping challenges, round ligament pain, pubic bone pain. And the reasons why those occur are because your body is shifting and changing and you're carrying around more weight. And so the baby sits inside of your uterus, which sits right inside of your pelvis. And that will shift that whole pelvis out of alignment. So what we do is we check to see that pelvic rotation, get it back into the proper position, which number one will get you out of pain, probably make you much more happier throughout your pregnancy, and have a better delivery in the long run. Our office is a great place for you to be right now because we are certified in the Webster technique. That's a technique specific for a pregnant woman's spine. We're also certified in pediatrics, so we really encourage you to bring your baby to come get checked for their first visit. It will be complimentary. We just want to start your baby off on the right foot. And lastly, we're all moms, so we really are sensitive to your needs and we are just so happy to be a part of this journey with you right now.